talking about your health with the professionals from Fairmont Regional Medical Center on WHAR and the HAR News Network.
Good morning. Welcome to the AJR News Network. I'm Sunshine Wiles, and a couple of rookies in here in the Morgantown studio this morning, but we have a lot to discuss here with Fairmont Regional Medical Center, specifically the radiology department. Joining me this morning is Jamie Naternicola, the Director of Radiology at the Fairmont Regional Medical Center. Jamie, thanks for joining us.
I'm glad to be here.
You're nervous, and I was nervous because Dave had to be out of town, and Kyle is out with the Black Bears, so you're stuck with me, but that's okay.
We're good.
Yeah, we're very good. Tell me a little bit, just what's going on with the radiology department right now at the medical center?
We've had a lot of changes to the radiology department within the past year. We've gotten 2 new digital x-ray rooms, and we are in the process of putting in a new MRI machine. So that construction has started, and we're looking at about a 6-month period of time there before we get that machine up and running.
The changes are going on at a rapid pace.
Oh, very quick, very quick. We started the new digital x-ray rooms last August, and by October, both of them were up and running.
Now, you're talking about, you call it a new digital x-ray room. How is it different than something, will I notice a difference as a patient?
You will, because you'll notice your exams are quicker. In the past,
yes. That I like.
Yeah, in the past, the technologist would actually have to take what was called a plate, and they would take that plate in, take your x-ray, then take the plate to a processing room and run it through. Now it's all digital, so as soon as they take the x-ray, it goes to our computer system. So it really decreases exam time by almost half.
When people come in for an x-ray, it's normally under a circumstance where they need to be in and out fast. Is that a fair assumption?
Yes.
Okay.
Nobody wants to spend a lot of time there.
No. Talk to me about how fast we're talking about, because the sooner you can get that x-ray and a doctor can look at that, the sooner the treatment, right?
Oh, absolutely. And in all honesty, a routine x-ray, say a chest x-ray and a hand x-ray, you can be in and out of that room in 5 minutes.
Jamie, you talk about a chest x-ray. When I think about x-rays, I think of a broken bone. Now, I have a preteen stepdaughter, and we haven't gone down that road yet. I knock on wood. Now, you have kids yourself.
I do. I have 2 boys.
2 boys.
We've spent a lot of time in
I was just going to ask you.
hospitals and x-ray departments.
What do you see a lot at this time of year in the x-ray department?
This time of year with school back in session, kids are playing football and soccer. We do get a lot of sports injuries this time of year.
My husband's coaching, so there's a good chance that he may be injured too.
Oh, yeah, that's for sure.
Can I bring him on down?
Sure, anytime. We're open 24/7, by the way.
Fantastic. We're talking to Jamie Naternicola. She is the Director of Radiology at the Fairmont Regional Medical Center, and you have progress going on. There are changes at the hospital there, and specifically in the radiology department. You've been with the department for quite some time. I'm not going to tell your age because I didn't ask you. That's not the right, fair question, but you've been there for a long time. So what do you see in terms of changes, and how does that better the patient experience?
I've been there for 16 years.
16 years.
I've seen a lot of changes through that department. I mean, when I first started there, we were using film and dark rooms. So to go to this point where everything's computerized and everything is so much quicker, it's such a benefit to our community. And we're so proud to be able to offer these services to our community, because that's our focus. Our patients are our focus. And everything we do is to make that patient experience better.
When we talk about coming into the department, you know, they've been ordered to come there by a doctor. Yes. Maybe it was an emergency situation. How do you make it an inviting place? We're always looking for that in a hospital facility.
Well, with the hospital's had a lot of renovations as a whole, and the radiology department's no different. So we have more of a warm feel in the x-ray department. So it's very clean, very welcoming. We have great staff, you know, between reception, the technologist. We have very knowledgeable and welcoming staff to take care of your family.
In a situation like that, I'd say the staff really needs to work together as a team, and then you're working with multiple doctors, so I'm sure that can be a challenge. But how do you facilitate that so, as a patient, I never know what's going on behind the scenes?
You don't. I mean, everything behind the scenes is off in its own little world. So you come in, you get your x-ray, you go on your way, and then the work starts. Then the staff works with the physician to get the read, to get the report to your doctor. And
now, as the changes are going on at Fairmont Regional Medical Center, especially there in the radiology department, some of those have already taken place.
Yes.
Some will continue. What kind of feedback are you getting from patients who maybe have been in the department before and they're seeing changes, or first-time patients? I call them customers. I don't know if you want to call them customers, but they kind of are.
They are. They are. We've had a lot of great feedback. The community's been very excited and has been happy to come and see the changes, and a lot of them have commented on all the different things that have come around.
As you're seeing more discussion about Fairmont Regional Medical Center, we talk about it regularly here on Wellness Wednesday on the AJR News Network, and we're hearing more and more about the changes and expansion and growth. Does that affect who you're seeing as far as patients go, where they're coming from?
Yes, to an extent, because some of the services we are offering are more than what we had in the past, especially the new MRI unit coming. We're offering MRI. We will be offering MRI services 24/7, as opposed to the way we do it now, which is only 4 days a week. So that's going to bring in a lot more growth as far as that modality is concerned.
So you'll probably see some patients from other parts of the region
Yes.
who, and really probably going to come to you because the facility, while growing, is that kind of small community.
Yes, we are a community hospital. We do have that at-home feeling. We're a lot more close-knit than some of the bigger facilities are.
We're joined by Jamie Naternicola with the Department of Radiology at the Fairmont Regional Medical Center. Tripping over my words there. Jamie, I think we'll take a break, and you talked a little bit about some of that faster turnaround. We can talk about a decrease in patient radiation dose maybe when we come back. We'll take a break and return with Wellness Wednesday here on the AJR News Network.
We're talking about your health with the professionals from Fairmont Regional Medical Center on WAJR and the AJR News Network.
I just wanted to make sure everybody knew that we were ready to go. Jamie Naternicola is joining us. She is the Director of Radiology at the Fairmont Regional Medical Center. We're talking Wellness Wednesday and the radiology department there. Some changes, some growth, some new services as well. Jamie, you've been with the department, you said 16 years, so I know you've seen a lot of change. How are we getting to a point that we're giving patients everything we can? I know it's a large investment. I mean, you're having to spend money to make these changes. Worth it, though?
We are, and it is worth it. We recently purchased a new digital mammography machine. We've had that for about 3 years. So last year we started doing stereotactic breast biopsies.
What does that mean?
That is a less invasive biopsy for a patient. If they have a lump in their breast, they can come in. It's actually an outpatient procedure. They just come into the department, they have a small sample taken for biopsy, and then they go home.
Jamie, we're talking about kind of making this quicker for patients to get in and out. And when you say minimally invasive, I should say, that's the first thing patients want to hear. They want to hear that they're going to be in and out quickly.
Yes.
How are you using new technology in the rest of the department to better serve your patients?
We have a 64-slice CT scanner that we've also started some new programs with that. We're doing a calcium scoring screen. It's a $99 exam. You come in. We actually use the CAT scan machine to take images of the arteries in the heart to see if there's any calcium. So that's a screening exam. It indicates if you're at risk for heart disease in the future.
As you see doctors sending people over to you, you probably see a whole list of things that people need to be checked for. What's most common in the radiology department?
The most common diagnostic X-ray is probably our biggest. The most exams we do. CTs, we do a lot of CTs, outpatient, ED patients, and ultrasound. Ultrasound is probably one of our other biggest areas.
And as I'm thinking through my head, I told you earlier that I just think of, oh no, the kid with the broken bone. We got to make sure that's the case. Is it a hairline fracture? What's going on here?
Oh yeah, we have nuclear medicine. We do mammography. We have a cardiac catheterization lab. We do a variety of procedures.
One of the things that we want to touch on this morning here on the AJR News Network with Wellness Wednesday is the radiation reduction process. What's changing in terms of patients being I guess, what's the word I'm looking for?
Well, as technology increases, your radiation dose is decreasing. So our new radiology rooms, those new digital rooms that I talked about, actually provide about half of the dose as a traditional x-ray room. In our CT department, we are monitoring patient dose. We've set limits for what dose this exam should give, and we monitor if that dose goes above that in certain patients and figure out what we can do to prevent that in the future.
Jamie Naternicola is the Director of Radiology at the Fairmont Regional Medical Center. We're here talking about some changes there. This is Wellness Wednesday on the AJR News Network. Jamie, I don't understand, I don't understand a lot, but what, in terms of the radiation, is that something that I need to understand as a patient, or you just say, hey, listen, we have the latest technology to protect you as much as possible? What are some of the risks, and why should I be thankful that that's what you have?
Well, as radiologic technologists, we are concerned with dose every day. So we are monitoring that, and we are ensuring that you're getting the proper procedure needed for your condition so that we can make sure that that dose is reduced, or if it's unnecessary, we address that with the physician.
Looking at the website here, Fairmont Regional Medical Center, it's www.frmcwv.com, and the services listed from your department are vast. The list goes on and on and on. One of the sections that we've touched on here that I've come across is advantages of MRI. What are the advantages to MRI?
MRI is used a lot. We see it a lot for back pain. We can diagnose a lot of back injuries. It can be used for, we talk about sports injuries, ACL tears, things like that, rotator cuff. MRI is used for a lot of issues like that. We look at the muscles, and where, CT and regular x-ray looks more at the bone.
I mean, is there really an instance where someone goes to the doctor and they don't need some sort of test like this? I mean, that's rare. Tests are being ordered for everything, but these really are tests that get to the bottom of a lot of different questions that doctors and patients may have.
Oh, yeah. We can make a lot of diagnoses with these exams. And our technologists, like I mentioned, as well as our radiologists, if we feel that something is not necessary or that a test would be better as opposed to what has been ordered, we will address that. We'll talk about it with the radiologist, who will talk about it with the ordering physician. It's rare that that does happen, but if it does, we make the suggestions as to what needs to be done.
Communication, I don't care what business you're
Absolutely.
in, communication is key. So if you're continuing to open that door between your team and the radiology department and doctors and patients, then it just makes the whole experience a bit more smooth, doesn't it?
Yeah, and that is the benefit of working in a smaller community hospital too, is we are all like, a big family. We know our ordering physicians. Everybody in the community knows each other, so we work together very well.
Jamie, you told me a story off air, and it's one of my favorite stories. At one point in my life, I was an education reporter, so it was always cool to be around the young kids, of course, when they're not yours, and you're not having to administer the discipline. It's always great. But there could be, young kids do get testing like this.
Absolutely.
And that could be nerve-wracking. I mean, the room is not well lit, and, hopefully your parents are in there with you, but if not, that can be a scary situation. How do you alleviate that so that kids aren't nervous?
Well, I have taken local daycares on tours through the radiology department. So when they come into the department, the first thing I do, is I welcome them and I say, this is where we take x-rays. It's a big camera and it's not going to hurt you. So they get to come and they look at the equipment, and we show them stuff. And one group, we put them on the CAT scan table and just raised it up and down, and they thought it was like an amusement park ride. They loved that. But if they get to see that before they need it, then when they do need to come to the hospital, if they do, then they can say, "Oh, I've been there. That's just a big camera."
Well, I was going to say maybe the kids can be anxious, but you probably have more trouble with the adults who come in anxiously.
Sometimes, yes.
Some of these tests require patience on their end, doesn't it? It takes a little bit of time to maybe get through. So what would you recommend for folks who have to come in for testing? I know you make it as welcoming as possible, but don't freak out. We're going to get you through. It's going to be okay.
Yes, absolutely. Understand that we know what we're doing, and we will take care of everything needed as quickly as possible.
You're listening to Wellness Wednesday on the AJR News Network. We're joined by Jamie Naternicola, the Director of Radiology, with 16 years experience. I keep looking at that number. I either keep trying to take away years or give you extra years. Certainly you have been in the department there for quite some time, Jamie, and you're noticing changes. For those who may just be tuning in, talk about some of the renovations and then some of your future projects that you have coming, because it's a work in progress.
It is a work in progress. We have updated 2 of our x-ray rooms to the new digital rooms, which are quicker. They're less dose for patients, much easier for the technologists. They love the new technology. We are getting ready to start this MRI project, which is huge. We've never had an MRI machine in-house. So this is a really big project that we're taking on, and it's going to require a lot of education to staff. We're actually reaching out to our local first responders, because everybody has to understand how strong that magnet is. I mean, you can't just go into that room. So we need the fire department and the police departments to know what the risks are involved in that room, because you can't run in there with, fire extinguisher or anything like that. Yeah. So we're providing a lot of education to the community and our staff with the new MRI machine. As we move forward, we've got some other equipment that we're looking at, a new nuclear medicine camera, which will also be less time and less patient dose.
What's that used for? You're throwing these things out at me, and I'm just like, oh yeah. Oh wait, what? What does that mean? So what? How will that benefit the folks in our region?
The nuclear medicine department, they actually inject the radionuclides and then take imaging.
Okay.
So instead of just actually using radiation to take the pictures, they inject it into the patient. So we do cardiac stress tests in there. We do bone scans, a variety of exams. So this new machine, just like the digital x-ray machines, does decrease the patient dose and decrease the time.
And it opens up the services that you can provide. We talk about Fairmont Regional Medical Center being a regional medical center, but you have a lot of folks just from the small area of Marion County who come there. But do you see, with some of these services expanding and having more equipment, do you see people coming in from across the region? Is that what you're hoping?
Yes, that is what we're hoping, and that's why we wanted to make it a regional medical center. We are a community hospital, but we want to serve the region, so we wanted to open that up a little wider.
What do you think patients will find there that maybe they won't get someplace else? It's a nerve-wracking experience to come to the hospital for many people, no matter what the situation is. So what am I going to notice first off that says, okay, that I'm in the right place, I'm getting the best care possible?
It's a smaller facility, so it's easier to find. The people there are just so warm and welcoming. The staff, a lot of the staff has been there for a long time. I mean, we have staff just in radiology that's been there over 40 years. So there's a lot of pride.
That's probably good in the medical industry, isn't it?
It is.
Because there are lots of stops along the way that folks can pick up a job.
Yeah,
okay.
There's a lot of pride and a lot of experience in our staff. We've been through a lot in that hospital, and we've remained, and we're happy to serve our community.
As you talk about some of the changes on the way, do you have hopes for some other things coming down the pipeline? I know that we're seeing a lot of things changing, and you probably want to go on, the director's door, or the main chief, and say, "Hey, we want." But what do you see in the future?
It's kind of hard to do, because we have gotten and are getting so much already. I mean, so much has been invested in radiology, but there is more to come. Our equipment hasn't been updated in a long time. So to all of a sudden start getting all this new stuff is really exciting, and we're hoping it continues.
It's like Christmas at the hospital.
It is. It is. I've said that ever since this all started. It is.
Doesn't that help you retain staff too?
It does. Yes.
Everybody
really
wants the new shiny toys to work with.
They do, and to see the growth gives them hope and promise that we're going to be around.
Okay. Where will folks... Will they be referred to you, Jamie, or is this something that I can call in and say, I think I need to have this checked out? That's not how it works, right?
No. You will go see your physician, and they'll lead you to, if an exam needs to be ordered.
And can you request, hey, I'd like to go to Fairmont
Absolutely,
Regional Medical Center?
and I hope you would.
I'd like to meet Jamie Naternicola, and I want to take the preschool tour with her.
I want to take a ride on the CAT scan machine.
Jamie, we're out of time just like that. Thank you for joining us for Wellness Wednesday on the AJR News Network.